Risks of intussusception after monovalent rotavirus vaccination. Risks of intussusception, a common case of intestinal obstruction in infants and toddlers, is slightly but significantly elevated after vaccination with currently licensed rotavirus vaccines, according to results. Two large
Regular trips to the doctor are a normal part of a child's first year. Baby Jose, baby Stanislav, and their moms are here to see their pediatricians at Harvard Vanguard in Boston.
Hi, Stan. How are you?
During this visit, both babies will receive immunizations, including the rotavirus vaccine.
Immunization is very important because it protects them against vomiting, diarrhea, disease for babies.
Good job, Bubba.
7 years ago, a rotavirus vaccine was withdrawn from the market after being associated with an increased risk of intussusception. In this uncommon disorder, a portion of the small or large intestine slides forward into itself, much like a telescope, causing severe abdominal pain and vomiting.
Because the rotavirus vaccine is given to almost every child in the United States, it's crucial to monitor the vaccine's safety.
Dr. Irene Shui from Harvard School of Public Health and co-authors studied the Rototech rotavirus vaccine, which became available 6 years ago. Almost 800,000 infants aged 4 to 34 weeks received this vaccine from May 2006 to February 2010, including more than 300,000 first doses.
Our study did not find an increased risk of intussusception following the rotavirus vaccine.
The study appears in this week's JAMA, Journal of the American Medical Association.
This result was the same whether we looked at the longer 1 to 30-day risk window following all doses of vaccine. In particular, when we looked at the first week following the first dose, we also did not see an increased risk.
We're going to do rotavirus. Okay.
That's a little drink.
That's a little drink.
Researchers say introduction of the rotavirus vaccine has a tremendous public health impact for children like Jose and Stan.
The benefits from rotavirus vaccine in terms of reducing the number of hospitalizations and deaths from rotavirus disease far outweigh the potential risk of intussusception that might exist.
Thank you, Angel. Aren't you doing great?
Catherine Dolph, The JAMA Report.
Here we go.
applications in medicine. Background. Although current rotavirus vaccines were not associated with an increased risk of intussusception in later trials before licensure, recent post-license data from international settings suggests the possibility of a small increase in risk in intussusception after monovalent rotavirus vaccination. We examine these risks at population in the United States. Method. Participants were infants between the age of 4 and 24 weeks who were enrolled in 6 integrated health care organizations in the Vaccine Society Data Link Project.
It's very important for people to know the value and importance that ultrasound can bring to diagnosis and care. It's always been used in pediatrics, but even in pediatrics we need to be reminded sometimes that it's a very useful tool and that there are always new things we can do. For me, one of the biggest things that has changed during my career this far is in the evaluation of intussusception. So intussusception is where a piece of the intestine telescopes inside of another piece of the intestine. And what happens then is that the bowel is obstructed, the kids get very sick, and even to the point where pieces of that bowel can die, they can perforate and lead to a great many complications. So it's a pretty common condition in kids that are under 2 or 3 years of age. So traditionally during training, the way to diagnose these was to do an enema exam, and it's very efficacious. And the nice thing is that if the child does have an intussusception, that's part of the treatment. The problem is that most kids who are suspected of having it don't actually have intussusception. So that means a lot of children are undergoing a rather unpleasant study as well as being exposed to radiation, and there was actually no benefit to them in terms of diagnosis or treatment. So about 8 years ago, people started talking about doing ultrasound for intussusception. And I have to say I was initially a little wary of that. We had a fairly tried and true system, even though it was sort of unpleasant for the children, but it worked. and no one was really sure whether or not this would be truly sensitive and specific enough in this pretty important condition. But as experience and research has borne out over the years, it's about
Pros and cons. Cons, no pros. Effects may have irritability, diarrhea, meal and temporary vomiting. Intussusception is a type of bowel infection treated in a hospital and may need surgery. In some babies each year in the United States, and general reason with the cause is unknown.
Intussusception is a medical condition where the intestine telescopes in on itself, causing an obstruction. The symptoms are severe colicky pain, drawing up of the knees, and guarding. These episodes may be intermittent. They increase in frequency with time. There's a classic triad of symptoms that has been described, but these are present only 15% of the time and include pain, mass in the right lower quadrant, and current jelly stool. This next video shows a child who is classically guarding as well as drawing up her knees at the end of the video. Watch closely.
Where does it hurt, Boo-Boo? Show me. Show me. Point. Can I touch you here? Touch you here?
Did you see the child push the examiner's hand away? That was guarding. Let's see that again.
Touch you here?
This part of the video will show the child drawing her knees up.
Here? Show the nurse, Boo-Boo. Show her.
The last part of the video showed the child drawing her knees up. If you found this video informative, please Intussusception is a medical condition where the
Diseases. Urticaria. Hives are red races, often itchy, are displayed on the surface of the skin, and are usually an allergic reaction to food or medicine. You can get comfortable, your concentration is short, you never feel normal. You do confusion in clinic allergy testing, yet nothing in progress. Patient after patient left their years of exercises behind, thinking they are completely cured. I know my findings will help a lot of urticaria and anxiety because here I common plant and symptoms. Intussusception is a medical condition in which part of the intestine has embedded into another section of the intestine, similar the way in which the part of a cover-ship telescope slide in one another.
Female who was brought in for 2 days history of diarrhea. During the interview, it was brought up that the child has had intermittent episodes of high-pitched screaming when she looked really uncomfortable. Her exam is all normal, including a Guaiac-negative rectal exam. Your astute resident brings up the possibility of intussusception, but your clinical suspicion is not really high given the history mentioned. Now you're just looking for a quick way to end this visit, and bedside ultrasound is your answer there. In the second case, you have a 10-month-old male who was brought in for intermittent vomiting or lethargy. There's no mass or focal tenderness on abdominal exam. Though these are not the classic textbook presentations, you have a moderate clinical suspicion for intussusception and order an ultrasound. There is an adult ultrasound technician in-house, but she is backed up with cases from the rest of the emergency department. The pediatric radiology attending has to be called in from home if intussusception is found and a barium enema is needed. In this case, performance of a bedside ultrasound for intussusception would help facilitate the disposition of the patient. Just a quick review of some of the key facts of intussusceptions here. Intussusception is defined as the invagination or telescoping of one loop of bowel into another, dragging along its associated mesenteries. The inside bowel segment is called the intussusceptum, while the outside bowel segment is known as the intussuscipiens. Unlike adult intussusceptions, the majority of pediatric intussusceptions have no obvious lead points, and 90% of them are ileocholic. The classic triad we learned about pediatric intussusception, namely episodic colicky abdominal pain, right lower quadrant mass, and guaiac positive current jelly stool, it's actually present in less than 30%